In a world where nutrition trends dominate headlines and health-conscious choices are celebrated, it's easy to assume that eating well means staying healthy. Yet, for many individuals who appear to be following a balanced diet, symptoms like fatigue, mood swings, and memory lapses persist. These puzzling signs may not necessarily stem from poor dietary habits but rather from a more complex issue lurking beneath the surface, a vitamin B12 deficiency caused by impaired absorption. Vitamin B12, also known as cobalamin, is a crucial nutrient involved in numerous bodily functions. It plays a vital role in the formation of red blood cells, the maintenance of the nervous system, and the synthesis of DNA. Without adequate levels of this essential vitamin, the body can experience a range of complications that significantly impact quality of life. Despite its importance, the reality is that many people consume sufficient B12 through their diets but still suffer from deficiencies due to underlying absorption problems. The human body is a marvel of biological engineering, yet it is not without its vulnerabilities. One of the key reasons behind B12 malabsorption lies in the intricate process of how the body absorbs this nutrient. Unlike other vitamins that can be absorbed directly through the digestive tract, B12 requires a specific protein called intrinsic factor, produced in the stomach. This protein binds to B12 and facilitates its absorption in the small intestine. When this process is disrupted, due to various factors such as autoimmune conditions or gastrointestinal disorders, the body is unable to access the B12 it needs, regardless of how much is consumed. Autoimmune conditions present one of the most insidious challenges in the realm of B12 absorption. Pernicious anemia, for instance, is an autoimmune disorder where the body mistakenly attacks the cells responsible for producing intrinsic factor. This attack effectively blocks the pathway for B12 absorption, leading to a deficiency even when dietary intake is adequate. The irony here is that the very system designed to protect the body turns against it, sabotaging the ability to absorb a nutrient critical for survival. Gastrointestinal issues further complicate the picture. Conditions such as gastroesophageal reflux disease, GERD, Helicobacter pylori infections, and low stomach acid, hypochlorhydria, can all interfere with the initial breakdown of food in the stomach. Since B12 is typically bound to proteins in food, an acidic environment is necessary to release it so it can bind with intrinsic factor. Any disruption in this delicate balance can lead to significant absorption challenges. Moreover, surgical interventions like bariatric surgery, while effective for weight loss, often come at the cost of altered digestion. These procedures can remove or bypass parts of the stomach and small intestine, areas critical for B12 absorption. As a result, patients undergoing such surgeries are at a heightened risk of developing B12 deficiencies, requiring lifelong supplementation to maintain optimal health. Age is another silent contributor to B12 absorption issues. As the body ages, the production of stomach acid naturally declines, which in turn affects the body's ability to extract B12 from food. This decline is compounded by the reduced secretion of intrinsic factor, making older adults particularly susceptible to B12 deficiencies. The consequences of this can be profound, impacting cognitive function and overall vitality in ways that are often mistaken for normal aging. The symptoms of B12 deficiency are varied and can mimic other health conditions, making diagnosis challenging. Common signs include fatigue, irritability, brain fog, and neurological disturbances such as numbness or tingling in the extremities. These symptoms can be easily dismissed as stress-related or attributed to other causes, delaying appropriate treatment. In some cases, the deficiency can progress to more severe manifestations, including memory loss and even irreversible nerve damage if left untreated. Understanding the root cause of B12 deficiency is essential for effective management. While dietary sources such as meat, poultry, fish, eggs, and dairy products are rich in B12, they may not be enough if absorption is compromised. For those who follow plant-based diets, fortified foods or supplements become even more critical. However, for individuals with absorption issues, relying solely on dietary intake is insufficient. Innovative approaches to supplementation, such as sublingual B12 tablets or injections, offer alternative pathways for delivering this vital nutrient directly into the bloodstream, circumventing the digestive system entirely. The medical community has made strides in recognizing the significance of B12 absorption challenges. Diagnostic tools have evolved to detect deficiencies more accurately, with tests like serum B12 levels and methylmalonic acid, MMA, tests providing valuable insights. These advancements enable healthcare providers to identify and address B12 deficiencies before they escalate into more serious health concerns. Public awareness campaigns have also begun to shed light on the complexities of B12 absorption. Educating individuals about the nuances of nutrient uptake empowers them to advocate for their health and seek timely medical intervention. As more people become informed about the potential for hidden deficiencies, the stigma surrounding nutrient-related health issues begins to dissolve, fostering a culture of proactive wellness. Research continues to explore the intricate relationship between gut health and B12 absorption. Emerging studies suggest that the microbiome, the collection of microorganisms residing in the gut, plays a pivotal role in overall nutrient metabolism. Imbalances in gut flora can disrupt the delicate ecosystem required for proper B12 absorption, highlighting the need for holistic approaches to health that consider both diet and digestive function. In addition to addressing absorption issues, lifestyle factors also contribute to B12 status. Chronic stress, for example, can negatively impact digestion and nutrient absorption, creating a cascade of physiological effects that extend beyond the gastrointestinal tract. Managing stress through mindfulness practices, regular physical activity, and adequate sleep can support overall health and enhance the body's ability to utilize nutrients effectively. As the conversation around B12 deficiency gains momentum, it underscores the importance of personalized healthcare. Each individual's journey with B12 absorption is unique, shaped by genetic predispositions, environmental influences, and personal health histories. Tailoring treatment plans to meet these individual needs ensures that interventions are both effective and sustainable. For those navigating the complexities of B12 deficiency, collaboration with healthcare professionals is invaluable. A multidisciplinary approach involving nutritionists, gastroenterologists, and primary care physicians can provide comprehensive support, addressing not only the immediate deficiency but also the underlying causes that contributed to it. This collaborative model fosters a deeper understanding of the interconnected nature of health, emphasizing the importance of treating the whole person rather than isolated symptoms. The story of B12 deficiency serves as a reminder of the intricate interplay between diet, digestion, and overall health. It challenges the notion that simply eating well guarantees good health and invites a more nuanced exploration of the factors that influence nutrient absorption. By embracing this complexity, individuals can take empowered steps toward maintaining their well-being, ensuring that the essential nutrients they need reach the places in their bodies where they are most needed. In a rapidly evolving landscape of health and wellness, the narrative surrounding B12 deficiency continues to unfold, revealing new insights and possibilities for improvement. As research advances and awareness grows, the hope is that more individuals will recognize the subtle signals of B12 deficiency and seek the support they need to thrive. After all, true health is not just about what we eat but about how our bodies respond to it, a dynamic process that deserves attention, understanding, and compassion. If you're watching this, chances are you've felt the weight of fatigue, struggled with brain fog, or noticed your mood shifting for no clear reason, even though you're eating well. You're not alone, and it's time to look beyond the plate. The truth is, your body might be doing everything right in terms of diet, but if absorption is the issue, even the healthiest meals won't give you the energy and clarity you deserve. Vitamin B12 is more than just a nutrient. It's a key player in your body's ability to function at its best. From keeping your nerves healthy to supporting red blood cell production and mental clarity, B12 plays a role in almost every system in your body. And yet, many people go years without realizing they're low, because the signs can be subtle, easy to brush off as stress, aging, or burnout. The good news? Awareness is the first step. Understanding how B12 works, why absorption matters, and what you can do about it can change the game for your health. Whether you're considering a simple supplement, exploring sublingual options, or working with a healthcare provider to address deeper gut or autoimmune issues, there's always a path forward. So don't let tiredness or confusion become your new normal. Take control. Get tested. Ask questions. And remember, just because you're eating well doesn't mean your body is getting everything it needs. Sometimes, the real work starts after digestion. If this video resonated with you, hit that like button, share it with someone who might need to hear this, and subscribe so you never miss out on more deep dives into the science behind everyday health. Thanks for watching.